I'm Stuart Dixon. I'm a consultant in infectious disease and intensive care medicine here at Derriford Hospital. In this short video, we're going to walk you through the pathway taken by patients with potential coronavirus infection from here in the assessment area through into the hospital. Patients presenting to the emergency department with temperature, respiratory symptoms or a flu-like illness will be directed to the coronavirus clinic for further assessment. This is the coronavirus clinic. This is where patients attending the hospital with potential coronavirus illness will be assessed. Patients with fever, flu-like symptoms and respiratory symptoms will be assessed for hospital admission in this area. If suspected of having coronavirus infection and requiring hospital admission, these patients will be transferred to a ward where suspected patients with coronavirus infection will be cohorted together whilst awaiting results of further testing. The PPE required for working in this assessment area is the Amber Zone PPE. This is the Amber Zone PPE, surgical mask, apron and gloves. The same style of PPE is used in the wards where patients with suspected coronavirus infection are cohorted. Those patients with confirmed coronavirus infection will be transferred to a red zone area where all staff entering the area will wear appropriate PPE. Staff who are not working in this area should not enter a red zone area without the appropriate PPE. All staff working in the red zone area will wear as a base layer a set of hospital surgical scrubs. The first item to be put on in the dressing process is the fluid repellent surgical gown. The next item to be put on in the dressing process is a pair of long gauntlet gloves as demonstrated. The next part of the dressing process is to put on the FFP3 mask. The mask is fitted as such. It is important to make sure the upper elastic band goes well above the ear and the lower elastic band below the ear. It's important with ladies with hairstyles including bobs and ponytails that these are appropriately sited to allow for correct placement of the mask. The final piece of protective equipment to be worn is the face visor. Face visor protects against splash from any patient with confirmed coronavirus infection. All staff having completed a period of duty in the red zone will exit the red zone via a single exit. At the dirty clean line, the staff member will undress using the strict doffing procedure. The first step in the doffing procedure is the removal of the gloves. The gloves should be removed carefully, touching only the external surface of the glove. It's important whilst doing this that staff attempt not to touch the external surface and remove the gloves as so. On completion of glove removal, the member of staff should clean their hands with alcohol rub. Alcohol rub is perfectly sufficient to kill any virus which may have contaminated the hands during the process of removing the gloves. The next step in the doffing process is to remove the surgical gown. Surgical gown should be removed trying to minimise contact with the external surface of the gown as much as possible, touching only the inner surface. It should be rolled up at arm's length and placed in the waste bin. The next step in the doffing process is to remove the visor. To remove the visor, lean over the waste bin grasp the visor behind the mask area and take off in one movement into the bin.
Yeah, all good. I'm cut.
The final stage of the doffing procedure is to remove the FFP3 mask. This is undertaken having crossed the dirty clean line. Stand next to the bin, lean over and reaching behind the front of the mask, remove the FFP3 mask as demonstrated. Having removed all items of PPE, the staff member should make their way to the nearest sink in order to carry out a hand wash. This should be in keeping with standard practice and should take at least 20 to 30 seconds. Having washed hands, the staff member is free to continue with their normal duties. During the course of this video, I've explained the patient pathway taken by those with suspected and confirmed COVID infection. I've explained the PPE that we'll use in both assessment, in suspected and in confirmed areas, such as here in the red zone. Please have confidence in the PPE used. It is in keeping with both international and national guidance. If you have any questions about PPE in the context of coronavirus infection, or about COVID-19 infection, please escalate them through your line managers and we will respond.